There's something about a good conversation that brings people together. From sustainability to morality, public health to politics, we all benefit from learning more about everything that is important to our shared community. So I've created a space for exactly that. Here, I gather some of our brightest minds, up-and-comers, and members of many different communities to talk about what's important to them, to explore the nuances in their perspectives, and ultimately, to learn how what they're doing will help bring people together and change our world for the better. This is Bottomless Coffee with Jerome. Thank you for joining us. Hey everybody, and welcome back to Bottomless Coffee with Jerome. On this show, we have great conversations with incredible people who are working to bring us together instead of divide us further apart. And we do that over coffee or tea or water. Honestly, as long as the conversation is good, the guests can drink whatever they want. Today, we're talking with Val Rubin-Rashaad. Val is the Executive Director of the Youth and AIDS Project, or YAP for short. Welcome, Val. How are you?
Thank you. I am blessed, highly favored, and honored to be here with you in your presence. Thank you for having me.
I'm thrilled to have you here. From the very moment that I saw you, I felt your energy, and I was like, oh, I hope Val wants to be on the show because I know we're going to have a fantastic conversation.
You see, I responded right away.
Yes.
I'm excited to be here. Thank you.
Well, can you tell us a little bit about YAP?
Yes. So the Youth and AIDS Projects, we were founded in 1989 by Dr. Gary Ramafetti. So in the 1980s, Dr. Ramafetti thought, he had an idea if young people were engaging in the same behaviors as adults, why don't we think they're not at risk for HIV? Yeah. So the Youth and AIDS Projects kind of started from this research project, and he was the only person in the country at the time in the 80s that were studying the effects of HIV on youth.
Now, I wasn't here in Minnesota in the 80s. I was barely on the planet. I was a youth myself.
Yes.
During that AIDS crisis of the 80s, were youth, in fact, very much impacted?
They were. They were impacted. The landscape of the population that YAP works with looks very different now. Back in the late 80s, there was a lot of focus on prevention, and it kind of moved away from prevention to care and services. So, of course, we're doing more care and services. We are still very much involved in the prevention work, but what Dr. Gary Ramafetti did was really focus on young men who had sex with men who were HIV negative. And there's research out there at the time as to how much we saved the community by keeping folks HIV negative.
Gotcha. So, okay, you made mention to things changing a little bit over time. What is the current mission and vision of YAP?
So our current mission and vision is that YAP is here to support and inspire young people who are impacted by HIV and beyond.
Okay.
We know as an agency to be relevant, our goal is to end HIV. So if we end HIV, what are we going to do next?
Okay.
So we always have to look to stay relevant with the time and with the population and how we can best serve our community.
Now, you mentioned impacted as the word in your vision and mission. So does that mean you don't necessarily have to be HIV positive in order to be served by YAP?
Well, we have a few different programs. So we have our medical case management that works with young folks and their families living with HIV. We also have the prevention side. So we work with we do school and community outreach, we do HIV testing, and then also we have the COVID grant. So we are in schools, in homes. I grabbed a group of my son's friends and I sat them around the table. I'm like, look, this is what we're going to talk about today. So being very creative in how we reach the community.
So are you finding, if you're in schools,
Are you finding that you're having to kind of be a sex education teacher when talking to the kids in schools, or are you more supplementary to what they're already learning in schools these days?
We do have, so let me backtrack, because there's a couple of parts to that.
Okay.
So before I became the executive director, I was a prevention coordinator, supervisor, and case manager. And when my oldest child was in high school, it was bring your parents to work, or bring your parents to school.
Yeah.
And so I was in schools, but not like constantly going, until she brought me to school for Parent Day. What does your parent do for work?
Okay. Sure.
And so I brought a game and played STD Jeopardy with the students, and the teachers were like, "Can you come back? Because we can't talk about the stuff that you talk about." So now I have wonderful staff that continue to go into the community and do education with the schools and community clinics.
Okay, I'm gonna put you on the spot here, because I've been thinking about a game show and I haven't been able to figure out exactly what I want to do. Could you ask me a question from STD Jeopardy?
I have a question, because I was just talking about this story. So the question is, and I have a follow-up to this. The question is, what was the first drug used to treat HIV-positive patients?
Okay, and the one I can recall is like from the movie Rent, musical Rent, and I think it was AZT.
Correct. So when I first debuted that game at, I won't say which high school, but it was at St. Paul High School.
Sure.
And I asked this question, and this lovely young woman said, "I know the answer. I know the answer." I said, "You do? What's the answer?" She said, "Heroin." Ooh. I said, "Ooh, child." I looked at the teacher. I said, "I should come back, huh? I should come back." But then, oddly enough, I was talking to another group of St. Paul students and asked the same question, and this young man said, "I know it. I know what drug they use to treat it." I said, "What?" He said, "Heroin." I said,
Stop
"What
it.
are they teaching you all?"
Or what are these kids learning?
Right. Hence, we need comprehensive sex education.
Yes, clearly.
And that's a true story. It happened in the same week.
Wow.
Yeah.
So I've never really thought about kids learning the wrong things to such an extreme. Because now, even first from this anecdote, I'm hearing, okay, well, without comprehensive sex education, some kids are being led astray to like hardcore drug use.
Yes.
Even if it's only one or two children, that's the makings of a future crisis that we'll have on our hands. And so that's a real surprise. And I'm literally like co-chair of the Public Health Advisory Committee for the city of Minneapolis, and no one has ever mentioned that to me.
Yes.
It's like, oh yeah, addiction happens from doctors overprescribing or what have you, and not from people shooting up heroin because they thought it was going to keep them from getting HIV. Right. Not from sheer ignorance. No, okay, but YAP is now, are you part of the University of Minnesota, or is there just a partnership? What's that?
Yes. So, like I had mentioned, Dr. Gary Ramafetti, he was a faculty and professor in the Department of Pediatrics.
Okay.
So we were housed in the Department of Pediatrics, and then moved to the Department of Medicine, and now we're back home at the Department of Pediatrics. So we are a part of the university. However, the university does not fund us. We are 100% grant funded, and we are located off campus. So we have a principal investigator by the name of Calla Brown who works with us.
Okay, now so what does Calla do?
Calla, she is, Calla, she oversees us. She's our captain of the ship that's under the university, and she is in charge of a lot of our research, in charge of the research that happens at YAP.
Okay, well, what is the research that you do? I didn't even know that was part of YAP.
Yeah, well, to be a part of the university, and I think that's kind of why we're not an anomaly. I'm not sure if that's the right word that I want to use. But sometimes the university doesn't know what to do with us because we're more service now.
Okay.
Dr. Ramafedi had left about 10 years ago, so we kind of moved away from research because I'm a service provider. I'm not a researcher.
Yeah.
And so we're just now getting back into research. So our study right now is looking at the effects of the effects of COVID on our HIV positive clients. So we're interviewing our clients and how they have navigated this world that we're in right now.
Now, we had Dr. Nathan Chomilo on the show, and he was directing vaccine equity during the first major surge of the pandemic.
Mm-hmm.
And if I'm recalling correctly, immunocompromised people were some of the first to be eligible for the vaccine.
Yes.
Did you find that a lot of the youth that you served did go ahead and sign up for the vaccine, or was it more of a longer conversation, let's say?
For some, it's been a longer conversation.
Okay.
We still have some that are not vaccinated that we're talking to, but like I said, I think I had mentioned just briefly earlier, the landscape of YAP has changed. When I was a case manager, well, I'm still a case manager, let's be real. But when I was slowly a case manager, our population was different. Our population looked different. I think I might have had 1 or 2 African American clients when I first started. Now, 88% of our clients are people of color. So when you look at our medical system, you know there's distrust. So people have that wrong idea of, oh, that vaccine was just created. Like, why am I going to take that?
Right.
And why they're pushing it to the black community now when they didn't push anything else to the black community? We didn't get any education on anything, but now you want us to be the first to take this vaccine? So it's getting over those conversations and having those conversations with people where, you know, they would bring up Tuskegee, and I said, oh, they didn't give us the medication.
Right.
Now they want to give it to us.
Well, I would say we can be historians of people when it comes to certain things. That generational trauma certainly does transfer.
Yes.
Now, you've made a few different allusions to your professional journey, and so we've been peppering the conversation with it. So let's just back up a little bit.
Okay.
Why don't you walk us through your professional journey? From the beginning, I want to hear about the chickens.
I know. I had mentioned that I have been working since I was 13 years old.
Yes.
And raising chickens was one of them. My family, my mother and I flea marketed for a living, and one day she left without me and had all our merchandise and came back with 200 chickens and said, we're raising chickens. And I'm like, what? This is what we're doing now? But we moved around a lot and wasn't in a military family, just moved around a lot. My mom made it an adventure. And graduated from high school out in California, came back to Minnesota, and we were driving down Lake Street, and I knew that we didn't have a place to stay, but it didn't dawn on me that I was homeless.
Right.
We were just come back to Minnesota, driving, and I said, hey, can't you live in the dorms? My mom was like, yeah. I graduated with really good grades, even though we moved around a lot. Yeah. So I walked into Concordia University and said, hey, can I go to school here? It's like August. I think school starts soon. I saw the football team. They were cute. Okay. I'm still friends with the football team, which is pretty funny.
You checked out all the important things on campus.
Right. I liked the name. The colors were blue and gold. I'm like, you know what? This is the school for me. And so I never really thought that I would graduate from school. I was just thinking.
Did you get to go?
Yeah.
Oh.
Yeah. They accepted me right away.
That's amazing. I would accept you too.
Like 2 days later, I moved into the dorms because school was about to start. Like, it was a really quick process. Later, I realized they needed people of color, but that's all right.
Take it how it comes.
That's all right, yeah. And so, but I still never thought that I would graduate. I mean, I had good grades, but I really didn't like school. And then I had my daughter. So I'm now, I graduated high school early.
Okay.
And so I had my daughter when I was 18, and I was like, well, damn, now I have to stay in school.
Oh, okay.
Not that I wanted to really graduate, but now I have her, and I'm bringing her to classes with me, not really realizing maybe you
Wait a
shouldn't
minute.
bring your kid to class. I didn't know. I was 18. I put her in my backpack, and she just went to class with me. Yeah.
Well, that's wonderful, though, because you hear so many stories of people dropping out of either the workforce or from higher education because they have children. So I'm glad that you didn't ask questions and you just went forward to live your life.
Yep, and I pushed her in the story, like putting her in a backpack was really a true story, but I snuck her in with me, so she wonderfully enough never cried, so I never got in trouble. Nobody ever said anything. The professors were looking forward for her coming to class.
Just sit in the back.
Yeah, just in the back, be quiet. It was fine. And so I always thought that I'd probably end up being a teacher. Okay. One, Concordia is a teaching college, and I got my best grades in civics and political science. And so that's what my degree is in political science. So I went to now, 4 years later, I'm graduating, and I go to this private college job fair. One thing I always knew is the day that I graduated was the day that I was going to get off welfare, because it can be hereditary.
Okay.
My grandmother was on it, my mother was on it, I was on it when I was in college, and I was like, my daughter is not going to know this once I graduate from school.
Yeah.
So I go, and there's interest from the CIA and the FBI, because I was political science.
Sure.
However, you got to be 23 to work for the FBI. So I was like, well, I can't wait that long. And then the CIA, it takes a year to get vetted, although I had a second interview with them. And I was like, I need a job now.
Yeah.
21-year-old Val really didn't think, maybe you should work this out. I could be working in the CIA.
I mean, that would be really cool.
It would be. So
tough times in that department these days, but still very cool.
So, but I ended up dropping off my resume to the Salvation Army Booth Brown House, which was a court-ordered youth shelter at the time.
Okay.
And so they happened to call me like 2 days after the fair, and they said, are you interested in working part-time? And I'm like, yeah, I graduate school. I need a job. And so I'm like, how much does it pay? They're like $5.42 an hour. I'm like, fantastic.
Oh, okay.
I'll take it.
Sure.
Didn't know, like with my 4-year bachelor's degree, that I would be excited making $5.42.
Welcome to nonprofit life.
Right? Welcome to nonprofit. And so I walked in the unit, and I was on the girls' unit. And there was about 20 girls on the unit, and they were filthy mouth, they didn't want to be there. Sure.
Sure.
However, I walked into the unit, and I fell in love with each and every one of those girls. Yeah. And then after talking to them, I called my mother, and I said, hey, were we homeless? And my mom was like, yes, silly. And I'm like, I never knew. I just thought we were going on adventures.
Yeah.
So I saw myself in those girls, and ended up working at Booth Brown House and the Bridge for Runaway Youth and Face to Face, and ended up at District 202, which is the first LGBT youth center created for youth, by youth. And Michael Kaplan was the executive director, and myself and Kirsten Gerber were one of the first adult hires at the time. We're still all friends. This was over 30 years ago. And they hired me to be a bouncer.
Oh, a bouncer?
Mm-hmm. Even though I knew social work.
Well, FBI, CIA.
Right, I had guns at the time. So they hired me to be a bouncer at their youth dances on Fridays. Okay. And then a job came up as a street outreach worker. So I did street outreach with them for 5 or 6 years with Streetworks. Streetworks is still a collaboration that's going on today with wonderful, wonderful youth workers that are still out there fighting the good fight and just making me very proud. I met with a bunch of them on an opioid response call last week, and just lovely to see that the organization and the collaboration is still a thing. However, I came to YAP in my 6th year doing street outreach. I got pregnant.
Okay.
And
Child number 2. Okay.
Yep, baby number 2, 10 years apart. I would do street outreach, and I would look for homeless youth. I would be under the bridges. I worked in the strip clubs as well. They would let me do outreach in the back to the women at the strip clubs.
Yes.
Me and my pregnant belly.
Oh my gosh.
Then I was 10 and a half months pregnant.
10 and a half?
40 weeks is 10 months. So this 9 month, you're pregnant for 9 months is not a thing.
Okay, men know nothing.
So one of my very dear friends who worked at YAP was my street outreach partner as well.
Okay.
And so I'm walking, and I was like, I don't think I could do this anymore. 6 years, I did it through my whole pregnancy.
Yes.
And my friend said, well, there's a position for a prevention worker at YAP at the Youth and AIDS Projects. I knew what he did, but it's doing the prevention interviews with young men who had sex with men. And I said, well, do you think gay boys would talk to me about their sex life? And he was like, well, hell, until you got pregnant, we thought you were a drag queen anyway. I said, okay. I took that as a compliment.
Yeah.
I said, okay. And so walked into YAP and haven't left. So I've really, really enjoyed my time there. The people that I get to work with, I feel like their family, the young people that I get to work with, I think are just amazing. And to see their growth, one of the things that kept me in youth work is that you meet someone at 14 and you get to see their development from 14 to now. I'm using a reference. There was a client I had. I met them when they were 14, and they're now much, much older.
Sure.
But I've seen them through graduations, through marriages, through their children's birthday. Now their children are off and living their lives. So you get to see that evolution that you might not get to see when you meet someone and they're 45.
Yeah.
So that's it. Yes, so I've been to marriages, divorces, graduations.
Yeah, you're there for life.
Yeah.
That's beautiful.
Yeah.
Well, thank you for sharing your professional journey with us. Let's take a quick coffee break and then come back and dive more into the services that YAP provides.
Okay, thank you.
Awesome. We'll be right back.
I am a mother of 3. I'm from Puerto Rico, but been in the Midwest since 1994. I have 3 beautiful children, one a 20-year-old trying to figure out adulthood. Then I have a 14-and-a-half-year-old in Northeast Middle School. And my little one got drilled how important it is to keep everybody safe. I suffer from type 2 diabetes, hypothyroidism, so my immune system is compromised, and I'm overweight, as you can tell. So my little daughter started telling me, Mommy, please get the vaccination. I don't want you to die. You need to go to my graduation. You need to do this. And I told her, I'm going to do this for my kids. I really, at that point, to be honest with you, I was like, but I thought to myself, okay, I need to do this because all the reports and all the symptoms people are dying from, I don't want to be there. So when I got my vaccine, I was a little hesitant, but I noticed the next 3, I didn't get sick at all, no symptoms like other people have experienced. My husband said, well, I don't see any horns or any tails coming up. I guess it's safe for me to have the vaccination. She even told me one day, Mom, you realize we're part of history? I was like, oh yeah. He says, who knows? My name might be one of those history books. I'm like, oh my God, what? Where do you come from?
When you tend to your mental well-being, you're able to balance the positives and the negatives. You can celebrate the good and cope with the bad. What excites me the most about the work we do at Live More Screen Less is how it focuses on that balance. Our mission is about the balanced and intentional use of technology because we understand the good and the bad they can provide.
Live More Screen Less engages with school and community members to listen to the effects of screens on well-being and to provide positive and practical well-being resources and education to spark balanced and intentional use of devices.
KK Myers and I founded the organization in 2019. In 2021, a digital well-being law was passed to provide digital well-being awareness and education for all Minnesotans. The Minnesota Thrives community has contributed to our growth through contacts we've made through the webinars we've conducted as well as the webinars we've attended. And the Minnesota Thrives community has been a great tool for us to become more aware of all the incredible agencies and entities who are supporting mental well-being throughout the state.
Through Live More Screen Less's education, youth voice-centered initiatives, workshops, newsletters, and trainings, we are reaching Minnesotans of all ages to ensure we all have the tools and support to thrive in a digital age.
We are back with Val Rubin-Rashaad from Youth and AIDS Project, or YAP for short. Now, okay, earlier in the conversation, you told us a bit, you gave us a bit of a list about the services that YAP provides, but I'd love to take kind of a deep dive into them. And I think the first one you mentioned, and one that you did yourself, was HIV case management.
Yes.
So what is that?
So we have a medical case management program, and I have to get a shout out to my YAP staff. I don't want to leave them out.
Okay.
But we have Raquel, who is a lead case manager, and we have Gage, who's one of our case managers as well. So with the medical case management program, the main goal is to make sure that our clients are virally suppressed.
Okay.
And that means that they have a viral load of less than 200. They're undetectable is another term for people who might not know.
Yes.
And we want to make sure that they're in care and they have insurance. But a lot of times they're worried about where they're going to sleep, their mental health. Do they have a job, employment? I'm hungry.
Yeah.
So we work on getting them those services
Is that
as well.
medical case management, or
It's how we get to their medical case
Okay.
management. Currently, and I'll give a plug about this later, but we're going to hire non-medical case managers, so our medical case managers can focus more on the medical side of things, but our focus is always on their health, their overall health as a person. But sometimes we got to deal with them being hungry.
Yeah.
It's hard to talk about how to take your medication if your stomach is grumbling.
Yeah.
So we want to make sure that we address those needs so we can really talk to them and focus in on their health and make sure that they're understanding what's happening with their bodies, understanding their medication, understanding what the doctor is saying to them. So our medical case managers, well, all of our workers are advocates for our clients.
Yeah.
So we do insurance work, a lot of referrals for housing, a lot of referrals to the doctors. Before COVID, our clientele is younger. We work with clients between the ages of 13 to 30.
Okay.
And so our case managers do a lot of hand-holding with our younger population just to make sure that they really understand what's going on, and then we kind of wean them and make sure that, okay, you know how to fill out applications, you know what the Ryan White services are and what that means, and when you have to fill out those applications. So our medical case managers work really closely with the clients to develop the care plan that the client is like, these are my needs and this is what I want to work on.
Honestly, these medical case managers sound like superstars because really, the more of these conversations I have, the more I'm finding that it's like a constellation of different service providers that you have to be plugged into, depending on where your life has taken you.
Yeah, yes.
And so for your service managers to be able to navigate all of those different organizations and kind of handhold like a 13-year-old through those, and then like, teach them how to navigate these systems that are not easy.
They're not easy.
It's really, really beautiful. And that shout out was well deserved.
Yes, yes. And so, and I had my colleague, Raquel, there's times where, we have to coordinate all these pieces, right? So we may have a client that has a mental health worker, a housing worker, an immigration person, and just bringing all of those people to the table so we can provide the best services for our clients. It could be a challenge, and they make it work. So shout out to my case managers and my client service coordinators. We also have HIV prevention. That prevention services, I should say, not just HIV.
The jump y'all were doing is prevention.
Yes, so we've always had prevention services, and so Ocean Loon does. Do you know Ocean?
We've met over Zoom.
They are wonderful. They're from the South, and all of my people make me smile. But I told them the other day, just hearing them talk, it makes me smile.
Yes.
But he's over our prevention, or they're over our prevention services. So they do HIV testing in the community. They do community engagement. They sit on a lot of boards. They were president of the Ryan White Planning Council for a time. They co-chair the Fast Track Cities initiative.
Oh my gosh.
So they're very busy. We also have so for our prevention services, like I said, it's HIV testing, and it's also COVID-related services as well. So we're holding small groups within the community, mostly focused on LGBTQ youth. So we're doing that in the community, and so we're having surveys and following up with groups just to get their knowledge around COVID.
So let me thread a needle, because I think this is correct. You do the HIV prevention service. Part of that prevention service is testing. You identify someone who has HIV, they kind of get associated with your medical case managers.
Yes, if they test positive.
If they test positive, yes. And then the goal is to keep them healthy and then get on the proper medication.
Yes.
That will get them to be undetectable.
Yes.
And undetectable means untransferable.
Right.
U equals U.
Yes.
And that is another aspect of prevention.
Yes.
Okay. I'm with you.
I know, I could say a whole lot. So thank you for threading that all together.
I got to make sure. And is the COVID-19 work similar? Or are those the conversations that you're having with the community about why people should be vaccinated?
Yeah, those are the conversations that we're having within the community.
Gotcha.
So, So we do, of course, we'll be talking about COVID moving forward.
Yes.
Our particular grant, I do believe it ends at the end of this year for that, unfortunately. But we will continue to weave it in throughout our conversations with our clients and with the community at large.
And then, do you host vaccination clinics?
So yes and no.
Yes and no.
Yes and
Why
no.
not do them both? Sure.
So I sit on community, for instance, I'm a part of MA, and MA's Minnesota African American AIDS Initiative.
Okay.
And so we hold every year a Sarah Simmons showcase. So we help put on the clinics. So
Gotcha.
So at the Sarah Simmons showcase, and there'll be another, we're planning one this year as well. We've done it for the last 13 years. And last year we hosted we did a testing event and a vaccination event. YAP was part, MDH put on an HIV testing and COVID vaccination event, so we had testers and we promoted at the event. And then there was an event at YAP. So YAP by itself doesn't, we help, we assist, we partner with people so we can bring it to a larger,
honestly.
So that's why I said yes and no. We don't do it by ourselves, but we partner. I just couldn't think of the word right away. So we partner with our other community members to put on the events.
Certainly, if it's someone, if one of you call them members or clients or one of your youth, let's say, is comfortable being vaccinated, then the medical staff, maybe medical case manager, might also schedule like their booster shot.
Yes,
because the new boosters are available.
Yes,
I haven't gotten mine yet.
Yes, yes. So they are doing that as well.
Fantastic.
Most definitely. And now we're talking about monkeypox.
I was
and making
gonna
sure.
talk about monkeypox.
Yes. So we're also talking to our clients and referring them to their providers and folks like the Red Door and the Aliveness Project. The Aliveness Project has a vaccination event, I think this Thursday, the 23rd, coming up.
Well, I'm not going to say yes because I'm not sure about that, but I'm just really grateful that more vaccines are available.
Yes.
We had Maddie Laidlaw from the Minnesota Department of Health here for a conversation. And that was back when, 2 whole weeks ago, when the vaccine was not able to be found anywhere and the requirements for getting the vaccine were very strict.
Yes.
And limiting.
Yes.
Frankly. So I'm really happy that they opened up. And I'm happy that you're able to have conversations with your youth to steer them towards vaccination if it's a good idea for them.
Yes, and I just got off a call right before I came here today that they are loosening the restrictions. So people previously, if people previously were turned away for restriction, like especially like the Red Door Clinic, those are no longer in effect right now. So people can call and get vaccinated.
That's real good because people get mad.
Yes. Yes. So and just the messaging that we're hearing, it changes all the time. Yeah. So it's very confusing for people. And no, you didn't miss a call. It was just...
Okay, so medical case management.
Yes.
HIV prevention.
Yes.
COVID-19 education.
Yes. And I'm hiring, like I said, for a non-medical case manager, and we'll also offer benefits counseling to our young folks who are enrolled in the program and living with HIV.
And what is benefits counseling?
So benefits counselors they will be charged to help our clients apply for Social Security if need be, apply for the Ryan White services as needed. Sometimes it can be hard navigating entitlement programs like SNAP, the food support programs, and general assistance. So getting all that kind of paperwork. We have clients who previously were undocumented and just getting all those kind of things together. So this person will be charged with helping our clients kind of navigate those systems.
Well, here's a question for you. In the first part of our conversation, you mentioned welfare. You said, I'm going to break the cycle or get there will be no more welfare in this family. Do you differentiate the services that YAP provides from welfare, or has your opinion on welfare changed since you were, I think, sneaking your child into classes in college?
It has changed because in the 60s and 70s and 80s, when I was on welfare, it was much more intrusive. There were times where workers would come to your house to see if men's shoes were in the closet, in your closet, to make sure, yes, that there wasn't someone there that could help provide and that we weren't cheating the system. So it was much more intrusive. I had inherited a ring from my grandmother, and I went in to meet with my worker, and she was like, "Why don't you pawn your ring?"
Stop it.
No, true story. True story. So it was much more intrusive. And even when I started at YAP, since I knew how to talk the language, a lot of my clients, they would still have those intrusive conversations. Things have changed now, thank goodness.
Yes.
over the years, but workers would ask, how come you bring her to our meetings? And I won't curse, but my clients would be like, so I don't kill you.
Yeah.
That's why I bring her. She's my buffer.
She's your buffer.
Right. She's your buffer. They said it much more colorful.
Yes.
Much more colorful than I did. But my opinion has changed. And I know that our clients are in a situation that was different from mine. I had access.
Yeah.
And I knew how to. This is why I love being at YAP. I don't know if you could tell I'm a cheerleader.
Sure. Yeah.
I was a cheerleader at all the high schools I went to.
Because you'd be near the football team.
Yes, I could be near the football team. Exactly. So I'm a cheerleader, and I love being a detective.
Oh.
And so I think of YAP that we are their cheerleaders. And I knew how to get things. I knew how to access things. Where our clients, not that they can't learn it, but they just don't know.
Yeah.
So we're here so their access is different. So we're here to help them get that access. So I think that's why my views on it were different from myself, because I knew that I had access.
Yeah. When navigating complex processes is such a vital skill. And it sounds like you've got that in spades.
And sometimes it's hard. And it's like, when you think about the county systems and you're asking a 16 or 17-year-old who may not be out to their parents, who may not have even told their parents that they're living with HIV, and they choose to take this on themselves, and, to have them. Sometimes it's hard for me even I have to go jump through hoops to figure out the answer. So to expect, a teenager to figure these things out.
And it's not even hard to imagine. Like almost every time I have to fill out a government form, I'm like, why is this so complicated? I have a JD, okay? I'm like, what's on the back? What are all these extra notes? What is this other thing I have to reference?
Yes.
And then to imagine having to go through that process for so many different aspects of your life.
And telling your story over and over again.
Yeah. Now, let me hit you with another question then. Because I would find that very frustrating. It sounds like your experience with the system as a younger person was very frustrating. And now we've been kind of combating the disease HIV for quite some time. And after 2020, we're all basically armchair virologists now. We're all frustrated with COVID-19.
I
so
think
do
I have
you
COVID
find
brain.
yourself getting frustrated? And then, how do you manage it? Because you're dealing with this all the time.
I think I was very frustrated with leadership. When we think back to, I did a webinar today, Healing Through History. I sat on this Healing Through History webinar, which was fantastic. And through this whole pandemic, I was thinking, haven't we been through this before? Haven't we been through a pandemic? Didn't we learn?
Yes.
Why aren't we wearing masks?
Yes.
So it's been very frustrating. Yeah, and to see
the answer is yes.
Yes, it's very frustrating, and just to think about all the people that we've lost. YAP lost a client, unfortunately, to COVID at the beginning of the pandemic. So it's been really hard to see that. Some people still aren't taking it seriously. I mean, yes, we're kind of moved into a different phase, but I was listening to the news this morning that they found another variant. I forgot the name of it. Don't quote me on the name of it, but they were just talking about that on the news this morning. And so I'm like, well, what does that mean for us now?
Yeah. I mean, I think we know it.
Right, we know what it means. We know what it means. Yeah.
It means that we are moving forward into a new phase of the pandemic, and we have dropped our protections.
Yes.
We know we need to be masked and boosted and in a well-ventilated room, or
Yes.
preferably outside if we want to remain healthy.
Yes.
And it kind of seems like without the paperwork associated, we have to navigate the system of COVID-19.
Yes.
So, maybe I'm not filling things out in triplicate, but I'm leaving the house with masks. I've got a mask in the glove compartment, or.
Yes, yes. And then I get mad when I sometimes slip and, forget, because I still want to mask up, when I'm in public, when I go to the grocery store, and I find myself, if I'm rushing and I'll get to the store and I don't have my mask, and I'm like,
Yeah.
like
that
I
feeling.
still
Yep.
feel that, I feel a lot of anxiety.
I almost feel embarrassment sometimes when that feeling catches me. I'm like, oh, these people can see my whole ass face. Just walking around in public with my face exposed.
Right. Yes, yes. And the anxiety, I don't know if we've really tackled the mental health portion
we have not.
like we should. Because, even when I'm in the car, sometimes I think you're too close, and I'm in my car. Why are you driving so close?
Well, I think we living in Minneapolis, Twin Cities metro area, we can really see how the fabric is kind of starting to fray in our society.
Yeah.
And I really think it's people like you who are like helping to hold things together for at least some people. You know what I mean?
I'm trying.
So let me ask you another question, kind of related to that frustration question. Was frustration the right word, the right emotion to ask you about? Because maybe it's not frustration, maybe it's something else.
I have, personally, it's a lot of anxiety.
Anxiety.
Mm-hmm. It's the anxiety.
Yeah.
It's the, I know what I need to do to keep myself and my family protected. I know what information to give to people, but I think that we are in this time of fatigue. I think people are also fatigued.
Yeah.
So we're anxious, fatigued, frustrated with this whole thing, and I think that's why people are getting loosey-goosey with it, and some people are like, well, it ain't killed me yet, so which is not the right attitude to necessarily. It's not the right attitude to have, but I can understand it.
Yeah.
Yeah,
Empathy.
yeah, but for me, it's a lot of anxiety. Especially, I got a young one in school who's going back to school, and they bring back everything.
Everything.
So,
Yeah. It used to just be comfortable.
Right.
Yeah, we send kids to school or to daycare, and they come back and they get everybody sick. And that's just the
the
life.
thing.
I'm
Yeah.
like, is it? Well, let me ask you the flip then to
Yes.
that question about anxiety or frustration. What is it that gives you hope, or whatever the opposite of anxiety is?
Like being in this field that I am in and working with the young people, they are, and not to be cliche, but they are resilient. They are much smarter than I was. It's so much. Sometimes I think they have too much access to information, but I do see, especially with the trauma that our city has went through over forever, but especially over the trauma of Mr. Floyd, just seeing how our young people have taken the reins and are really leading us through this charge of change.
Yes.
And it's going to be the young people that really help us in this fight with HIV, I think in this fight against COVID. I've been the executive director since 2017. And I've been there a long time, before 2017. And I always say that it may be time for new blood. I still, want to stay, not saying I want to quit or anything like that, but just bringing in the fresh ideas from the young people.
A deputy executive director.
Right. That gives me just a lot of hope to see what's happening, with our future. Like I said, my colleagues that I work with are just amazing, so they give me hope. I want to see people that look like the community that I serve in leadership.
Mm-hmm.
That's why I don't think it necessarily has to be me.
Yeah.
You know, so that gives me a lot of hope and a lot of excitement for the future.
Giving me hope right now. And don't sell yourself short. Don't sell younger Val short. You did walk into college and get admitted in 2 days. So.
I did.
Well, let's take a quick coffee break and then be right back.
Okay.
With you.
Thank you.
Be right back, everybody.
Hello, my name is Kathy Flaminio, and I'm the CEO and founder of Move Mindfully. And we are a training and consulting company that brings the science of mindfulness, movement, and social emotional learning into simple trauma responsive practices that are used in schools, hospitals, juvenile services, corporate and daycare settings, and even in the home. When we think about what is mental well-being, I think we have a clear understanding after living through a global pandemic with heightened uncertainty and not feeling safe. We learn the great impact it has on our nervous system. Here at Move Mindfully, we teach these simple tools to help our mind and body feel at ease and feel safe so we can connect to others. And when we think about mental, physical, and emotional well-being, we think about having a regulated nervous system. What excites us at Move Mindfully is we have created programs that are workshops, trainings, residencies, family nights, in which we go through our simple breathe, move, rest signature practice. So creating simple visuals like this that allow our adults and youth to know, like, what strategies would I do if I'm tired, or if I have high energy, or if I'm feeling anxious. Both as adults and children, we're able to create a culture of safety where people can learn and heal. We are so grateful that our initiative with Move Mindfully has really been able to expand, not only into schools and districts, but counties, hospitals, and juvenile services. And we've been able to do this through our partnership with Minnesota Thrive and Minnesota Department of Health and Minnesota Department of Education, through these state health improvement grants that really focus on physical health, emotional health, and mental health. And through these simple tools, we're able to provide both the adults and the youth strategies so that everyone can thrive.
Bueno, pues mi nombre es Miguel Jaime, me dicen el Corre, trabajo para la raza 95.7 1400. Las cosas que me motivó o que me hizo pensar el realmente ponerme la vacuna fue el ver mucha gente cómo estaba en los hospitales, cómo los hospitales fueron subiendo con gente contagiada, infectada, y sobre todo mucha gente que estaba, pues en su momento, cuando estaba la pandemia fuerte, muriendo. Incluso tomé la decisión, tanto por mí, sobre todo por mi familia, porque no quería, y lo estuve viendo también por parte de mi familia, que tuve familiares que desafortunadamente con esto de la pandemia perdí, y fue cuando entonces pensé y dije, no, pues realmente hay que vacunarnos por el bien de nosotros y el bien de nuestras familias y nuestros hijos.
Not everyone with COVID-19 will make a fast or full recovery. Some people develop long COVID, symptoms like shortness of breath, extreme tiredness, headaches, dizziness, or other issues that happen for months or years after their COVID-19 infection. Even mild COVID-19 can lead to long COVID. We are still learning about long COVID, but care and support may be available. Find resources for patients, caregivers, healthcare providers, employers, and more at our website.
Bottomless Coffee with Jerome is back with Val Rubin-Rashaad, Executive Director of the Youth and AIDS Project. Well, Val, this is going to be your moment to shine. As we're closing, what are some ways that people can help support YAP?
Oh, thank Thank you for asking. So I just want you all to know that YAP is completely grant funded. So the University of Minnesota, although that's where we house, they don't fund us. So we rely heavily on donations, and you can find our giving page at yapmn.org, or you could Google the University of Minnesota, or you can just Google the Youth and AIDS Projects. We're also on Facebook as YAP_Minnesota.
Yeah. And when those job opportunities crop up, is that going to be on one of those websites as well?
Yes, so the job opportunities should be posted by the end of this week, so you can find them at yapmn.org.
Fantastic. And then is there any final message you'd like to make sure that people leave our conversation with?
Yes. HIV, as we know, disproportionately affects young people and young people of color. Young men who have sex with men who are in that category or same gender-loving men. It's still on the rise.
Oh.
Okay, so it's plateaued in a lot of communities, but not in the community that I serve. So HIV is still a thing. I know that it's not on the top of folks' conversation a lot of times, but it's still out there, and we are working really hard to end HIV in the state of Minnesota. And also, if you have not get vaccinated, please consider to get vaccinated for COVID-19.
Now, hold on a second, because you're talking about my people.
We can go
So
back.
the numbers are on the rise for HIV.
Yeah, so our target demographic for testing same gender-loving men of color is one of the target populations here in the state of Minnesota. And you can check out the Minnesota Department of Health website because they'll also talk about, there's also what people may not know, and not to throw anybody in a panic, but our numbers suggest that there's an outbreak, one in Hennepin County and one in Duluth, and that's mainly in the encampment. So I just want to know that, you know, that's out there as well. But statistically speaking, yes, our same gender-loving men, it still disproportionately affects the community.
Now, okay, so I've been in a monogamous relationship for a long time. So let me just make sure: did the condoms still work?
Condoms still work.
Okay, so we could be using condoms.
It could be using condoms.
I believe there's a medication called PrEP.
There's PrEP.
Okay.
Yes.
Could be getting on PrEP.
Yes.
Can abstain.
Yes.
There's some other things people can do that don't require the exchange of fluids.
Yes.
So there are other options.
And thank you for
available.
talking about PrEP. Yes. So please, if pre-exposure prophylactics, it's one pill that prevents the transmission of HIV. So if people can visit YAP to get more information about that, or the MDH website. If you can't remember, please come to YAP. Please come to our website. And you'll find more information about that. But there's many ways to protect yourself.
It's fantastic. And thank you for that entreaty. One story that came to my mind is when I was much younger. I was living in Atlanta, and a friend who I knew had HIV was at the doctor and was not able to get the medication that he needed at the time. This was somewhere after AZT and before the modern meds. And he was very much in a panic because even just those few years ago, missing your medication was going to have disastrous consequences on your health.
Yes.
And so we didn't have a YAP that I was aware of at the time. And so it's very important to me that our audience knows, go to YAP. If you're ever in a situation like that, they may not be able to help, but maybe they can point you in the right direction. And you got a friend in Val.
Yes, you do. Yes, you do. And we're very lucky that we live in Minnesota. We have access to care.
Yes.
So know your status is the best.
Wonderful. Thank you so much.
Thank you.
Yay.
This was fun.
I thought so. You're welcome back anytime you like.
Thank you. I haven't smiled so much so long in a minute, so my heart needed this.
We love to hear it.
Yeah.
And thank you all out there for watching. I am Jerome. This has been Bottomless Coffee with Jerome. Find out all about us at bottomlesscoffeeshow.com. See you next time.